Chris Ohl, Infectious Diseases, Wake Forest Baptist Health. So hopefully people won't give me a hard time about a tired, worn-out quote, but it's been a quiet week in Forsyth County for COVID. We're about 6 months into this now, so if you figure maybe another, that's probably about a third of the way through. So if you're looking, at progress, that's real. I think we're still going to have some bumpy times with COVID ahead of us yet, but right now, in the country, most of the activity of COVID that would be considered worrisome is in the Midwest and near West states. So kind of along the Mississippi Valley, actually, if you look at it. These are states that haven't really embraced masking or personal distancing all that much. And the cases a lot of these states aren't incredibly populous. If you look at the number of cases per 100,000 people, they're pretty high. And they're going up rather than down. Here in the southeast, most states are continuing to go down or have plateaued. Here in North Carolina, we have still our slow creep of a declining number of cases, declining number of hospitalizations, and actually a slow decline in the percent positive tests. In the Triad area, Forsyth County, our decline continues, and our percent positive tests is now roughly around 3% or so, which is really encouraging. That means only 3 tests out of 100 that you do are a positive, and that includes people who have symptoms. So that's a pretty good number. I'm very happy and content right now with where we're at right now here in most of the counties in our area. The only county I still have a bit of concern about is Guilford County, where the case numbers and percent positives have really plateaued out and haven't changed much since mid-August, whereas a lot of our other places have gone down some. So what's in the near future for us? I don't think things are going to change a lot for maybe the next month or so. We'll have to see what happens as we get into November. Everyone is, seeing the news reports about, we're going to have a second wave. Well, yeah, we probably will. Here in our area around here, our respiratory virus season usually starts late November, early December. And we've talked about before, so a lot of the things that we do to help prevent COVID transmission are going to help prevent those cold and flu bugs from being transmitted as well. So maybe that's going to be good news. We'll have to see. I still think the hardest time for us is going to be January and February, which is not that far off now. Got a couple of holidays to get through before then, but those 2 months are going to be a slog. So if you're into planning ahead of time, that might be a time to think about, that there may be a fair amount of COVID around, and it probably is going to be a time where we're going to want to be really careful. And for us in hospitals, we need to make sure we're all ready to go, and I think we are. I think once we get through February and into March, I think it'll be a downhill course for us after that. But we got a ways to go yet, and we'll be talking more about that as we go on through the next few weeks. What's happening with our schools? So universities in our area here, so far so good. Elon University had some cases associated with their football team. Seems to be relatively contained with that football team, but it did result in them raising their level of alertness on their dashboard a notch. Wake Forest doing pretty well, actually. Both in number of cases, percent positives, and surveillance. Davidson's also. Our schools, I think, in our area here and the universities are doing better. We profited from the experiences a little bit at Chapel Hill and East Carolina and NC State because we, saw what happened there and were able to adjust. As far as our private schools in our area, also so far so good. Small numbers of cases in the private schools in our area, all of which, to my knowledge, have been people who were students or teachers who were exposed actually at home or other social events, and then became positive, but because they were at school during the pre-symptomatic period, there were a few students who've had to quarantine, and that's to be expected, and that's actually encouraging when the cases are found and we can quarantine to keep transmission from occurring. I know of no actual cases of transmission that have actually occurred within a school in our entire region, and so that's good news. And in fact, there was just a report out in statistics that have been given that it looks like across the whole nation that the number of transmission events actually in the school building or associated with the school itself are fairly low. Almost all of the cases are people who have acquired it outside of the school, but because the student may have been there for a day or so, there are some quarantine necessary. What are the main things? There's roughly like 4 or 5 things that a school needs to do to have a successful bring back of students to in-person learning. The first one is The first one would be is limiting the class size as much as possible and getting the numbers down, because when you do that, you can spread people out within the 6 feet, and that makes both transmission much less likely, and it also makes contact tracing a lot easier. The second thing, everyone's got to wear a mask, and that includes all the students. And as we've talked about in the past, the young kids even seem to be doing great with masks. It's the older kids, those high school kids that kind of look at you out of the corner of your eye a little bit. They're the ones sometimes that have troubles with it. But teachers need to model it, and staff in the schools need to model it and be a good role example. Parents need to be a good role example for the kids too, with masking and personal distancing. The third thing is cohorting, which means don't, as much as possible, keep the kids from mixing. So you keep one group together and you leave them together through the day, including taking them the meal at lunchtime. And that helps with both reducing a possibility of a transmission, but it also helps a ton with contact tracing and quarantine, because if you're not mixing and you only have one class that's affected, you're going to only have to quarantine within that one class rather than large groups of people. The last thing is a very invested parent core and teachers. And what do I mean by that? Is that you guys are the primary stakeholders, the students and the teachers. Everyone wants to be in person in school. It's best for the kids. It's best for everybody. But you gotta be really careful with illness in your families, and that means if you wake up and Johnny seems to be not quite himself today, and normally you'd say, well, let's let him go to school and see how it goes, and we can pick him up later if he's sick. Let's not do that. Let's say, well, let's stay home today and see how he does, and it's just one day down if it turns out he's okay and it's just a bad biorhythm day or something. And certainly if a child has been in contact with another person known to have COVID, or you've been told that he's a contact or she's a contact, that means you're in quarantine. You can't go to school. And if you're told to be tested, you should be tested, then be tested. Be a good citizen. And lastly, and incredibly importantly, if you know your child has COVID, you gotta stay home. In fact, you're all staying home because you're in the same household, right? So it's unfortunate, but it's just one of the things that we have to do in order to try to be somewhat normal. So a little bit about schools. I wanted to mention Halloween again. I think it was 2 weeks ago we talked about ideas for how to have a safe and still fun Halloween. And the CDC came out this week with their guidance for holidays. And Halloween, they said no trick-or-treating, no parties, and don't use Halloween masks as your COVID mask. I agree with the latter too. I think that parties are not a good idea, particularly if you're doing it indoors. And then Halloween masks don't work as a mask for COVID, so I agree with that. The trick-or-treating one, I'm going to take a difference here with the CDC and say, I think there's some ways that one could do it safely. And we talked about those before, and you can go back to the archived Facebook. I think it was 2 weeks ago, and where we talked about everyone's ideas for Halloween. But basically, it's the same things: safe distancing, wear your mask, stay away from crowds, and the handing out of the candy can be done in a way where there's not a lot of personal contact with it. So I'll split with the CDC on that one. The other thing that was big in the news this week was last Friday there was a change in the CDC's webpage that seemed to state that COVID transmission is now thought to be all airborne and not droplet. Because we've been saying all along it's droplet, right? That's where the 6 feet comes in. That's why we mask. So a little bit, and then they pulled that down on Monday, and it's no longer on the web page, which reflects a little bit of confusion. But let me shed some light on what this is all about. So all along, those of us in science have been talking about droplet versus airborne transmission. I mean, we've been talking about this since January, even before COVID was in the United States. And there's still scientific discussion about this, and it kind of comes down to two large groups of people. One, who mostly are environmental engineers, physicists and chemists who study droplets and say, wow, we can find droplets from people with loud talking, singing, over there in the corner of the room, 16 feet away. We can find these small droplets. They're carried by air. So, of course, it's aerosol transmission. And those of us who are infectious disease doctors, epidemiologists, and people who, hospital infection prevention people, say, well, yeah, that may be the case, but really, it's the droplets that are within 6 feet that are infecting people. And those little tiny ones that waft far away, unless you're in an area that's really crowded or poorly ventilated or very small spaces, it's just not important. I'm in the latter group. I'm an infectious disease doctor, so in this sort of discussion, I think the vast majority of transmission's droplet. I think the vast majority of it occurs from person to person within a 6 feet place. And I think the aerosols are probably important only in small, poorly ventilated areas where there's a lot of people and a lot of movement to keep these aerosols up in the air. So where would those places be? Small bars where people are loud, boisterous, trying to talk above music. The place is small, it's not well ventilated. Small buses, if you think of like a rental car bus, maybe something like that. And then small rooms in places and buildings. So most of the places that we're at are just not like that. And a lot of the guidance we use, and even with fitness centers and how to spread out, space out, big buildings, well ventilation, are designed to get around that. So the whole aerosol versus droplet, if you're an average everyday person, I don't think you need to get into that argument and let us scientists debate that in a room. It's more philosophical in a way than it is a problem in reality. The other thing that came out which was sort of I think almost designed by the media to be a freak out report, is this about mutations. in the virus. This came out yesterday because it was a study in Baylor that looked at a large number of sequences of the virus, taking the DNA from one end to the other, or the RNA from one end to the other, and then seeing whether, how the code is. And they said, well, there's been mutations as the virus goes on. Of course there are. Every virus does that. And in fact, every living organism has small numbers of mutations as it goes on. Some of that's evolution, and that's, how animals adapt to their surroundings over years and years and years. But, viruses replicate very quickly, so you can measure these mutations in real time. And the word mutation is scary, mutants and things, and it kind of makes you feel like, in the world of Transformers or something, mutants are always bad, right? In a Marvel comic book, if you got a mutant, that's a bad guy. For the most part, anyway. I guess there were a few good guy mutants, but with this virus, what does it mean? So there are going to be mutations as time goes on. It actually turns out that probably the areas of the virus that affect virulence, which is its meanness and its ability, how severe the disease is, it really hasn't changed, and has been actually fairly stable. And there's still a lot of debate whether these small changes have changed the way the virus is transmitted. Because the reality of the epidemiology is that transmission and transmission effectiveness really isn't much different now than it was back in March or February. So perhaps these changes in the virus might affect its fitness a little bit, and what particular strain of the virus that might be circulating around. But again, I think for the average everyday person, I probably wouldn't be too concerned about this and the debate around that, because COVID now is really kind of the same as what COVID was back in March. And then people say, well, there's a lot less older people. Is that because the virus has changed? No, I think that's more because we're better at protecting our vulnerable populations and older people now than we were at the beginning. And in the beginning, everyone was sheltered in place, including younger people. Now that there's a lot more movement, people are going out and about, younger people are getting infected, they're more social, they have more opportunities for transmission. Think about it. When you were in college, how many people did you meet in a week? Versus if you're 64, how many people do you meet in a week? And I think that's what it comes down to. Lastly, and next week we're going to talk about flu a lot more, and we're going to talk about differences between colds, flus, and COVID. But I just lastly want to encourage people, make sure you get your flu shot. Time's here now. Flu shot time. So we want everyone to get a flu shot this year. Everyone over the age 6 months should get it. So that's all I have today. Are there any questions? All right, we'll see you next week, 10 a.m. Thursday.